Hi, I am Dr. Vijay Verma. I practice at Three Senses ENT Allergy and Dental Clinic. We all know that kids they are always suffering with a continuous sneezing, they are nasal obstruction, nasal discharge, sometimes bleeding from the nose, they have breathing difficulties, and I know that in every family the kids they are suffering with these problems. So because all of them they are going to daycare, in daycare they are suppose 20 kids, out of which always there is one or the other kid having cold and cough. So your kid is always prone to get these things. But in the depth, we ignore the symptoms of adenoids. The adenoids are nothing but they are just like tonsils. They are present behind your nose. When they get enlarged, they cause nasal obstruction to the child. The infection of the adenoids, it always gives rise to the continuous nasal irritation. Child tend to sneeze. There is always nasal discharge. When it falls back inside your throat, it causes sore throat. There is always continuous cough to the child. So all these things, plus when they sleep, they can't able to take oxygen properly, and when the oxygen is not going inside the body of the kid, they can't grow properly, and this is the one thing which is always missed. So one should consult an ENT specialist for this problem of adenoids, because after 12 years the adenoid, although they regress in the size, but the changes which they leave, they are permanent. They can come out protrusion of the tooth. So sooner or later you have to visit your dentist for this problem, which is a lifelong problem. Then there can be infection in the ears. There is a fluid accumulation behind the eardrum. So your kids start listening less. All these problems are associated with the adenoids. So adenoids, they start with the childhood, but the changes they leave is permanent one. So I'll suggest visit your doctor as soon as possible if you find that your child is having continuous sneezing, if your child is having continuous nasal discharge, recurrent episodes of cold and sore throat. So you should always visit your adenoid problem. For the adenoids, there are two treatment. Either you can go ahead with the therapy of the sprays, or you need to undergo surgeries. So it depends it is always dependent on the size of the adenoid. So first X-rays is indicated. Depending on the size, either he is medically treated or it is basically a surgical treatment. Now all of us are scared with the surgeries, but nowadays the surgical tools are very safe. Either it is done with a microreblator or a coagulator, which makes it a bloodless surgery, and it is usually not a painful surgery even in the post-operative period. So the kids, they feel happy. So I suggest you visit your doctor for all these present. You can also visit me via Lybrate.